today pay attention, because by the end of today's show, you're going to feel healthy, and if you have a back problem, we have some ideas that may really help you. A little bit later on in the show, Dr. Andrew Cash has a new procedure, minimally invasive orthopedic procedure that could really change your life. But with me, once again, returning, is Sherry Torkis, who we had talked. You're a pharmacist, but whatever that next level of pharmacist is. I mean, you're not the person behind Albertsons.
Well, I do dispense medications, okay, but my focus is really on natural medicine, holistic and preventative medicine.
Right, and we had a lot of response. You were here before. We talked about allergies and some natural defenses against allergies. Now we're here to talk about something a little bit more serious: women's heart issues. And I guess it's not women's hearts. I mean, the things we're going to talk about would affect men's hearts as well. The
things that I'll be touching on today definitely can benefit men as well. You know, statistically, heart disease is our #1 killer in North America, so it's really important for people to have a proactive, preventative approach to heart health, not wait until something occurs, that heart attack or stroke, and then start scrambling trying to figure out what you're going to do. If you live a heart-healthy lifestyle, and it doesn't have to be painful, there's some simple strategies that we can all follow that can benefit our heart.
You know, one of the things that I learned, you have this wonderful book, Saving Women's Hearts, and one of the things that I learned is that some of the symptoms that women have are different than men's symptoms when they're about to have a heart attack or having a heart attack.
That's right. You know, we think of the classic symptom of a heart attack as that crushing chest pain, and that is still a very common symptom that can occur in women, but women can also have more subtle symptoms. Even in the days preceding a heart attack, a woman can have a sudden onset of fatigue, weakness. She may have pain in her neck, her jaw, her shoulder. Symptoms may be more vague, and that's why a lot of women actually delay getting treatment and sometimes dismiss those early warning signs.
Yeah, I mean, what is it, like 1 out of 3 women will...
One out of 3 women, that's right, and it's actually approaching 1 in 2 women are going to die of heart disease.
Almost half of the women
almost half
will die.
Yeah. And you know, the sad part is that women are so, I think, worried about taking care of everybody else in their lives, their families, their spouses. We're very involved in careers and all of, juggling multi things, that we sometimes put our health at the bottom of the list, and we're slow to respond to some of the early warning signs.
Of course, there's a lot of contributing factors to heart disease, and some are within our control and some are not.
Right.
But the ones that are within our control, like stress reduction and weight and exercise and how you eat.
And how you eat. Actually, most of the risk factors for heart disease are within our control. Even high blood pressure and high cholesterol, 2 big risk factors for heart disease, are to a large extent within our control. And if you look at some of the greatest modifiable risk factors, diet, exercise, as you mentioned, stress level, not smoking, also getting enough sleep at night. These are really important things to pay attention to.
Okay, now you have an assortment of items here.
I do.
Which I'm sure each one of these items is probably good for your heart. Good
for your heart, and some surprising, I think. Right. So in terms of snack foods, a lot of people, when I'm talking to them about a heart-healthy diet, they have the misconception that it's just vegetables and fruits that you have to eat. Not the case. In fact, if you like chips or tortilla chips, you can actually find tortilla chips now. These are called corazonas. They're tortilla chips that are fortified with plant sterols. And plant sterols are naturally occurring plant compounds you find to a small extent in vegetables and seeds that can actually compete with cholesterol for absorption in the body. And there's been research to show that eating foods fortified with plant sterols or plant sterol supplements can actually help to lower your LDL cholesterol. So the corazonas, they contain, it's called Cora-Wise plant sterols, and you'll also find the plant sterols added to, this is Heart Right Milk by Smart Balance. You'll also find it added to oatmeal squares by Corazonas, a few other companies.
Is that just regular milk that they add it to?
That's right, regular milk that has the plant sterols added, and because of that, you can see, actually, I'm going to turn this slowly to the side so you can see the logo that you're looking for. Do you see that logo? It says Cora-Wise plant sterol. cholesterol.
With a heart.
With a heart.
Yeah.
And so that's easy to identify if you're in the grocery store. That's something that you can look at. And the FDA actually allows foods that are fortified with a certain amount of plant sterols to make a heart healthy claim. So that's something to have, add to your diet. If you have high cholesterol, you could be taking medication, not be getting adequate response, or you're looking for something to supplement with your medication. That is okay to take with, say, if you're on a statin drug or another cholesterol-lowering medication.
Does that alter the taste of the milk?
It does not, actually. The milk tastes just the same. You can also find orange juice fortified with plant sterols with no bad taste. In fact, the Corowise plant sterols, they're unique in that they don't have any negative impact on the taste or palatability of a product.
Wow. And I'm going to ask you about the chips in regards to salt.
Yes.
Is that they contain salt? And
These have a low amount of salt. You still have to watch salt. Some people are more sensitive to salt, and it can raise their blood pressure. But overall, I think as a population, we consume too much salt. Processed food, fast food, convenience foods, sauces, condiments, they have a lot of salt added. So we should go easy on the salt shaker because we get enough salt through our foods.
Okay.
And that can raise your blood pressure. So the next food that I brought are tomatoes. And there's been just a ton of research on tomatoes, popular food in the Mediterranean diet. One of the compounds that's in tomatoes that gets a lot of attention is lycopene. Right. And lycopene's been studied for prostate health. It's also been shown to have benefits for blood pressure. And what the newest research has looked at is these tomato complexes. Now, these supplements contain something called lycomato. And lycomato is a full spectrum tomato complex. So it's not just lycopene. It's lycopene along with some of the other phytochemicals or the natural plant-based chemicals that you would find in tomatoes. And there's been research to show that that can lower blood pressure just as much as many of the prescription drugs that we have today, but without the side effects. So when I have patients that come in to see me, they can't tolerate their blood pressure medicine, or maybe they have pre-hypertension. They're just a little bit over the normal range. The doctor says you need to do something, otherwise you're going to need medication. That's when we look to a lot of these supplemental strategies. So the lycomato, there are different brands. This is Healthy Origins or Vitamin Shop. There are many different brands that contain that particular tomato complex.
Right, and readily available, I assume, at vitamin stores and health food stores.
Vitamin stores for sure. And also, as we're talking about blood pressure, grapes. Again, part of the Mediterranean diet, right. Grapes and red wine, long known to have benefits for heart health, beneficial effects on cholesterol, also to reduce clotting and the stickiness of your platelets. But the American Heart Association, their position is don't start drinking wine to get the heart benefits. So you want to have grape juice, grapes in your diet, and from a supplemental perspective.
Well, before you leave the grapes, how much grapes do you have to eat to really make an impact?
Well, that is the thing with some of these foods. We're talking about a significant amount, really. You're talking about, at least what I have there on the plate, if not more. And you'd have to eat the seeds in the grapes as well to get some of the benefits.
So getting seedless grapes is
the seeds do contain a lot of the beneficial antioxidants and chemicals. And, we as a society tend to throw out the pits and the seeds in our fruits and the skins sometimes. And that's where you do get a lot of the beneficial compounds that are naturally present.
So do you eat the seeds from grapes?
I do.
The watermelon seeds?
And they're bitter. They're a bit bitter. And I don't eat the watermelon seeds, but I do try to eat the grape seeds. So grapes are great for health. This is a grape seed extract. It's called Mega Natural BP. Right. That has been specifically studied and shown to lower blood pressure as well. So for people that have high blood pressure, pre-hypertension, you may want to consider that. Now, there's been research that was conducted at UC Davis showing that not only reduces blood pressure, but it improves the flexibility of your blood vessels, so the overall health and flexibility of the blood vessels, which is beneficial for sure.
You skipped over, I noticed, the avocado. Maybe I interrupted you.
The avocados and the garlic. Well, I was going to touch on avocados because they sometimes get a bad rap in terms of
fat.
Fat. Avocados, yes, they do have a higher amount of total fat, but it's the beneficial fat, the monounsaturated fats. Avocados are also a great source of soluble fiber, naturally occurring plant sterols, antioxidants. So in moderation, avocados are completely fine. So enjoy your guacamole with your tortilla chips. It's all good.
How much, if you eat all these foods, How much of an effect would it have in reducing your blood pressure?
Well, for blood pressure and cholesterol, we're talking a significant effect. For example, if you have these foods fortified with plant sterols, there's been research to show that these plant sterol foods can lower your cholesterol by about 12 to 15%. Your LDL can lower by 12 to 15% as little as 2 weeks. That's significant. With the tomatoes and the Lycomato supplements, also the Mega Natural BP, research shows benefits within 30 days that these things can help to lower your blood pressure. And back to cholesterol, another food that can lower cholesterol is the red palm oil. Now, this is the olive oil, which does get a lot of attention for heart health benefits, but olive oil is really ideal to add to foods after they're cooked. It's not heat stable.
Where's the front of this? There it is.
There. Yeah, so if you can take a look at this here, we'll just bring it over here. It's the Caratina. It's canola and red palm oil. Now you see how this oil is actually red. That is not dye or anything that's added to the oil. It's naturally occurring beta carotene and antioxidants that give it that bright, beautiful red color. Palm oil is very beneficial in terms of helping to raise your HDL while having a neutral effect on your LDL, so it raises your good cholesterol. But what's also really exciting with, and this is the Malaysian palm fruit oil, it's actually derived from the palm fruit, not the palm kernel. So the Malaysian palm fruit oil has also been shown to be neuroprotective, to help protect brain cells against oxidative damage, and even if a stroke occurs, to have a protective effect on brain cells. So that's where some of the newest research is occurring with palm oil.
So would you use this for salad dressing or for cooking?
For cooking, you can use it for salad dressing, but where it really stands out in terms of benefits is it's heat stable. So you can use your palm fruit oil for cooking, whether you're doing a stir fry, you want to sear some fish, or you want to drizzle it on some vegetables and roast them in the oven. The palm fruit oil is heat stable, so it has a higher smoke point, so you can actually cook with it and not lose the beneficial effects.
Yeah, I have to admit, this whole oil thing is very confusing to me.
It
I
is,
have to
yes.
have, I have like notes on my iPhone of which oils are good or bad, because I can never remember which is what.
Think of olive oil, great for salad dressings, and add to pasta after food's cooked, or dip your bread in your olive oil if you're having bread. Palm fruit oil, you can use it in foods that are already cooked, or you can cook with it. And then fish oil, which I didn't bring fish today, but of course fish oil does have a lot of benefits in terms of helping to lower triglycerides, reducing inflammation, and reducing stickliness of platelets.
You have to be careful of the fish oil now too, because there's...
Yes, you do have to choose a good quality fish oil that doesn't have mercury and PCBs, and a really good manufacturer does screen for those things. Now that supplement you're holding there is called Tocozorb, and that actually... Yeah, and the reason I brought that is it contains tocotrienols, which are a potent form of vitamin E, actually derived from the palm fruit oil, and it has some very potent antioxidant effects. So it's kind of the next generation of vitamin E that does offer benefits for the heart and for the brain as well.
Now you have a lot of supplements. I don't know if you consider them vitamins or herbal supplements or whatever.
Nutraceuticals.
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 Okay. But like, is there? You take them all at the same time, or together, or?
Well, you really need to talk to someone to develop a supplement program. I think as a foundation, most people can benefit from, maybe a multivitamin of fish oil. If you have high blood pressure, you may want to take, the Lycomato or the Mega Natural BP, cholesterol. You have to look at your specific needs. You can't take everything that is promoted to be good for health, because you'd end up taking, a whole lot of things. You have to look at your needs. Now, on the far side there, I've got supplements. You're asking me about melatonin. Does that really work for sleep? Some people find it helps, others don't. Where the research is strongest on melatonin is for people that work shift work, travel to different time zones. That's where it can be really helpful. And the reason I brought supplements for sleep is that lack of sleep is a risk factor for heart disease. There's been a number of studies identifying that people that get 6 hours or less of sleep at night are at greater risk of heart disease. Big reason why people don't sleep today is they are stressed out. Too busy, their minds are too busy, they can't relax. But rather than turning to a pharmaceutical sleep aid, which can affect your short-term memory, cause next-day drowsiness, that's where you may want to look for a supplement. Those two bottles on the far side, they contain something called suntheanine, which is an amino acid that helps promote calming and relaxation without causing addiction or next day drowsiness. So those are things that I would recommend for somebody that is having difficulty sleeping because they're stressed. They have a difficult time relaxing, shutting their mind off, calming down. There's been good research to show that sun-theanine can promote calming and relaxation, improve sleep quality, and it's also been studied in teens as well. So that is one of the few things that we have research in actually children. I believe it was 8 and above that were studied with that. So these are things that you want to consider as part of your strategy, along with your regular exercise, stress management, things that can make a big difference in terms of heart health.
And of course, nobody's going to remember everything that we're
all
talking
of these
about.
details, yes.
So these are all in your book, Saving Women's Hearts.
That's right. And the book is available in all major bookstores, or you can easily get it on Amazon.
Why is it such a hard sell convincing women of the risk of heart disease compared to men?
Women do not see themselves at risk of heart disease. In fact, my co-author, Dr. Martha Galati, before we wrote this book, she did a survey of women asking them what they see as their major health threats. Most women see breast cancer as their #1 health threat. They do not see themselves at risk of heart disease. And when you talk to women about heart disease, they think, well, that's something that's going to happen later in life when I'm 60 or 70.
Right.
They don't think of it as occurring in their 30s or 40s or 50s. And, you know, we're hearing more and more reports of that. A lot of celebrities are actually helping to bring attention to the issue of heart disease in women. Some well-known celebrities that have struggled with heart disease themselves. So I think that we need to work harder on educating women about heart health and heart disease prevention and getting screened. You don't start getting screened for heart disease in your 50s. You really need to think about it in your 20s and 30s. Knowing your blood pressure, your cholesterol, talking about your family history with your doctor, and making sure that you're getting checkups routinely. Just as women go for their pap tests and their annual physicals, they need to be thinking about heart health.
Well, it's great information. The name of the book again, Saving Women's Hearts. Sherry Turkus is the author. It's great information and a great, healthy, and delicious way to live. My next guest, Dr. Andrew Cash,